Hi there. I am Alex Carney on the Communications Committee with CCHI, and I am happy to be sitting down and having this coffee break with CCHI Commissioner Andrea Henry, who has been gracious enough to join me for a quick kind of 30-minute, just chat about all things interpretation, our history and interpretation. From a person who's been involved in the industry for a very long time. So we are pleased to have Andrea here with us. Hello, Andrea. How are you doing today?
I'm good. I'm happy to be here.
Good. I'm glad to hear that. We're talking to ourselves and recording, so this is all very, very fun. I have a cup of coffee here with me to
yes,
assist.
Me too. Yes.
So
you're on the West Coast. Yeah, cheers. And I'm on the West Coast.
Your coffee's a little later in the day than I would be accustomed to. So,
it's actually tea, but yes.
Okay,
yes,
good.
Coffee Kudos. Cup with tea.
Kudos. So Andrea, thank you again so much for joining us today, or joining me and having this conversation. I was hoping maybe we could just chat a little bit about, perhaps your background in the language industry, how you got involved in it. Maybe we could start there, just with a little bit of how you came into the interpreting world.
Sure. I started in Oregon, where you are right now. It was 1994, and of course this was definitely pre cell phone and no widespread internet. But I had graduated from the University of Oregon, and I was in Portland, and I was working at the Heathman Bakery and Pub, which is no longer there. The Heathman is, but not the bakery and pub. But I was working there, and I was working in the kitchen, and I had a colleague come up to me who was working in the kitchen with me, and he said, can you come with me to a doctor's appointment? The doctor's not going to speak Spanish, and I don't speak English. And I said, sure. And it was really close to the restaurant. It was in downtown Portland. I vaguely remember it was in the northwest area of probably there's a hospital up there, drawing a blank, but it was probably right near that hospital or in it, but it's been a long time. And I have no recollection really of how I managed it. I just was a helper, really. I was saying what he said in English after he would say it in Spanish, and whatever the doctor said, I told him in Spanish, and he got what he needed.
Yeah.
And I walked out of there thinking, could there be like a job like this? Because I found myself thinking, even though I'd helped with interpreting for quite a while at the restaurant, and certainly in other jobs that I had in Eugene when I was going to the University of Oregon, but it was the particulars of that encounter. It was medicine, and it was somebody trying to help someone feel better, and somebody needing to feel better. And there was that need for someone to address the language barrier. And I thought, oh my gosh, like marrying medicine. And I did really like medicine. My dad had many health issues, which is one of the reasons, or the main reasons, I moved to Portland. And so just being able to combine medicine with the Spanish language and Latin American culture just seemed like the most beautiful synchronicity. And so I started calling around, but it was 1994, so I wasn't like on the internet trying to figure this out. I was looking in the white pages and the yellow pages, and someone at OHSU in Portland said, we also work with this company called Pacific Interpreters. And she must have given me the number, either that or I had to dig around to find it, but I had a name. And I called, and I don't remember the particulars, but I drove out to Gresham, which is, like a suburb. And I met Mary Reinerson, and I met Raquel, and I was interviewed and got the job on the spot with some degree of, caveat that they would give me some training. Eileen 3 Foot did give us some training. Eileen gave us a couple workshops. at different points. And then later, a couple years after that, I think Holly Mickelson did come to Atlanta, and we got an 8-hour workshop by Holly Mickelson on ethics. But at the time, all I had was a dictionary, and it was like a paper dictionary. I think it was a Larousse. It wasn't medical at the first one I had. I ended up getting the Rogers one later, but I just carried it around. I had paper on it. I don't know if kids still do this, but I had that, like that paper bag as a cover, and I had notes all over it at a certain point. And that's how I started. And my first appointment was at a Kaiser Permanente clinic. And it was a lovely woman from Peru. And I remember that just because I remember having to navigate a few different terms. Yeah. And she was just lovely. She went in with a bladder infection, or thought she had one. And I interpreted for it. And I went back in to interpret again. And she was also pregnant. And I thought, wow, this is just the most amazing job, because she was very happy about that. She just thought she was going in for a simple bladder infection. And so I ended up interpreting for her during her entire pregnancy and the delivery.
Wow.
Yeah. And so, because they kept setting me up, that was kind of how they did it. Like, okay, Andrea went on that one. We'll just send Andrea for every one of the OB appointments. And I was hooked. So I owe a debt of gratitude to Mary Reinerson and to Raquel. I loved working with Pacific. I worked with them for about 3 years total.
Yeah, that's really interesting. And, you and I met while I was working at Pacific Interpreters as well. And Bruce Murley, I remember, who I didn't work in his department necessarily, but he had said, I was working with the Spanish resources that we had, and he had said, hey, Alex, you need to speak with Andrea from Children's Healthcare of Atlanta about this research project that she's working on related to interpreter fatigue. And this must have been, gosh, maybe 14 years ago, 13 years ago, something like that.
Yeah.
And that was where you and I first met each other. And, again, it was funny. I was just watching the coffee, conversation that Jorge Ungo was having with Natalia. And he also mentioned Bruce Murley as the person that had been, somewhat instrumental in, I think, his career in language services. I know for me personally, the same, right? And it's nice to talk about that time at Pacific and Bruce. So
very much so. Yeah. He, when I was in management about 17 years ago, he was our account manager at Children's Healthcare of Atlanta. And he was the one who spearheaded training Pacific interpreter, OPI interpreters or phone interpreters to be more specialized in pediatric terminology. Yeah, he said, okay, because I had thrown that out there. Like, I think it's really tough. This is very different vocabulary. I certainly never engaged in this vocabulary when I was working in adult interpreting, and he was the one who made that happen. He created he created the energy to get it done, and then I think it was a group effort to create a specialization training for the phone interpreters, and then he also was the person who listened to us give a big presentation on the research and agreed to have Pacific Interpreters give us a grant, a no strings attached grant back in 2010.
Yeah, that's really wonderful. So really interesting story, for me. Do you think you could maybe talk a little bit about that research that you did on interpreter fatigue? And maybe, I've seen some presentations that you've done at various events in the last, handful of years on it, but maybe just any updates or a little bit of background on, how that came about, where it is, et cetera.
Certainly. Well, I'll start now and then I'll go backwards. We have completed the development phase, the internal validation phase, and the external validation phase. And those are just fancy words for we tested it at Children's and then we tested it outside of Children's. And we're done with all of the data collection and analyzing the data to understand our findings. And that's wonderful. We're waiting to get published, and then we can share the tool at no cost to the field. But where it started was a really long time ago. And, there's no shame in that. It's taken us a bit. We did something that is a little different. And so we had to kind of start from really from scratch. But in 2000, 2007, I was home, and again, this was something that just sort of happened that was a wonderful sort of falling into place of things. But I had uh, I had been interpreting at Eggleston, our level 1 trauma
Mhm.
center at Children's Healthcare of Atlanta, and I was home on medical leave. I'd had surgery, and I was home and reading emails, which is not really all that common for most full-time interpreters. There's not
Right.
generally that kind of time at work, and so I was home, and I had time, and there was an email that Natalie Kelly, she probably doesn't remember this, but she had put an email out on the NCIHC listserv. Thank you, NCIHC, for having a
Yeah.
listserv, because that was
Yeah.
pre-Facebook. There was really very few ways for us to connect as an industry. You know, you had your little group that you worked with, but to connect as an industry, we had the listserv. And so she had sent an email that was on behalf of a colleague and said, uh, you know, how are you guys measuring productivity? How do you know what your workload is of your interpreters? And how do you justify that you know, are keeping people busy, or how do you ask
Sure.
for more positions? Essentially, that was
Yeah.
the other layers to it. And I just was
Yeah.
sitting there at home, and I thought, you know, and in addition to that, she also got all the responses and shared them. And those responses were the exact same math that I had used, which is just minutes worked divided by minutes paid, which never gets you anything very impressive. And no one in the C-suite is ever very impressed by those numbers, and they don't quite understand
Right.
how it is that the productivity doesn't really reflect the level of complexity or fatigue that a
Sure.
team can have. And so I just wrote this like veritable thesis, you know, like, you know, 'cause I had nothing better to do. And I was like,
Yeah.
this is interesting. Like, I
Yeah.
suddenly realized that there's so much to the analysis that's not being incorporated into the way we look at productivity. And that
Uh,
process of sharing, like just getting it out
yeah.
and putting it in an email, got things started. And that's kind of where we started. I started approaching people at Eggleston. I approached Kathy Murphy, who is a cardiac nurse specialist in the congenital cardiac defects unit. And I had interpreted for her for a long time, and I knew she did research. So I approached her to see if she would be willing to help. And then we found a statistician, and we got started with trying to come up with a way to incorporate the complexity and the certain characteristics of encounters that do impact cognitive effort, like the amount
Right.
of cognitive effort that interpreters have for certain encounters. And that's what the premise of the tool is to incorporate that into workload and productivity.
Right. Yeah, it's fascinating because there's so many metrics associated with like productivity from the kind of business side of things, as far as, you know, number of minutes per hour, you know, worked.
Mhm.
But what is often really neglected in that is, you know, capacity of that interpreter to do a good job for a,
Mhm.
you know, sustained period of time over a certain number of hours at a certain level of busyness. And I know that that's
Mhm.
um, you know, challenging and really essential for people like yourself, I think, to help us quantify, you know, help the industry quantify, help the C-suite to quantify,
Mhm.
and create those measurements based not only on productivity in its, you know, traditional sense, but quality as well, and outcomes, I suppose, ultimately.
Yeah, that's exactly the argument, is that, like, if you look at nursing metrics, or the way and they struggle too, but they're obviously way ahead of us. But they look at all of that, like staffing, or how many nurses do we need, for example, so that they do achieve better quality. It's all about outcomes.
Right.
If we work these nurses too hard in the ICU, the patients are those that suffer. The
Right.
nurses do as well, obviously, but if the whole goal of healthcare is patient safety, good outcomes, then you've got to look at how you're staffing people. And they kind of have their own metrics in nursing that we used as a bit of a
Mm,
precedent. You know, they look at the complexity of the patient. You know, how sick are these
right.
patients, and therefore how many nurses do we need based on how sick they are. And if you start paying attention, you notice that, wow, in the ICU, like, most patients have just one nurse is responsible just for one patient, maybe two
Right.
maximum, if they're both not that sick. Whereas in a clinic, a nurse is potentially responsible for 4 or 5 at a time. And because those patients aren't sick, they're just coming for appointments. They're, maybe having blood tests done, maybe having some sort of evaluation, but they're stable. They came on their own to the appointment. So
Mhm.
there's all those things factor into it, but it's all about complexity. But with them, it's complexity of the patient. With us, it's the complexity of the encounter, like, because it's all cerebral work that interpreters are
Right.
doing, and it's all about cognitive load and cognitive effort, and certain characteristics bump up the effort.
Yeah, that's really fascinating topic. And, I think myself and people in the industry, look forward to just continuing to watch that project and watch it unfold. Because I do think it's instrumental, for the community at large, and ultimately the patients, that these types of things are being measured, creatively and thoughtfully. So thanks for your work on that.
Yeah.
On behalf of everyone.
I love it, but I love interpreting more than anything. And I do hope this
Sure.
tool keeps more interpreters on the front lines, because the tool hopefully will inform on pay and working
Yeah.
conditions. And that's kind of where my heart is with the research, is hoping that
Yeah.
it keeps us in the role of interpreting and not lose so many. Because in healthcare, and Johanna Parker, one of my fellow commissioners, has talked about this in her presentations, that we are really the lowest status as healthcare interpreters in terms of the overall industry. Legal and conference certainly are known to have a better pay,
Mhm.
better working conditions, more understanding. And I think in healthcare, we're still working to achieve that. And I think as a result, since we haven't really achieved it yet, we lose people. People move
Right.
on for good reason. They have kids to feed, or they've got bills to pay, and healthcare interpreting is not really known for being well paid. And so I think my hope is that in addition to the working conditions, the tool will also help with pay as well. Just proving the intensity of the work in some encounters, and just in general. It's incredible what an interpreter's brain can do.
Oh my goodness, I know. As a person that's, fluent in Spanish, I have been, asked in numerous times to, hey, come over here and interpret. And I cannot do it. I can speak Spanish fairly well, but putting me in an interpreter setting is not. It's a whole other skill set entirely, much less in a medical situation. You mentioned something about loving interpreting, and kind of that sort of the core passion that you have, I suppose, sort of underlying all these extra efforts that you make. You have taken sort of a unique career path, I think, in terms of being a medical interpreter, being a professional in this industry, that you could perhaps just elaborate on a little, having been an interpreter manager and then actually becoming an interpreter, strictly an interpreter. Maybe you could talk a little bit about just your career path, in that capacity, because it is pretty interesting. Usually it's the inverse of that,
Yeah.
or the reverse of that.
No, I'm a
So
little
yeah,
weird.
I'd love to learn, sort of that trajectory.
I like that I'm a little weird. I also drive a vehicle that doesn't fit my image, and I'll leave that for some other time. But people are like, I didn't think you drove like that car. But anyway, that's something else. But I didn't plan it. I didn't plan going into management either. I had
Sure.
moved to Atlanta from New York City. I was in New York City for about a year, less than a year. It kind of chewed me up and spit me out, and I landed in Atlanta. And I was volunteering at Northside Hospital. So that was 1998 through 99, maybe early 99. And I would go on Wednesdays, I think, and I would put on this like peach colored volunteer jacket, to have people know that I was a volunteer, and
Yeah.
I would volunteer as an interpreter. I told them when I wanted to volunteer that I had 3 years of professional experience, and by then I'd gotten a little more training by, like I mentioned, Eileen 3 Foot, Holly Mickelson, I saw Cindy wrote,
Mhm.
given in service in Portland. That was exciting. She talked about culture. No one had talked about culture up until that point. All my colleagues, but we were just constantly looking for words in our
Right.
respective paper dictionaries, and we
Sure.
never talked about how key culture was. But so I said, I'm just volunteering. My sister had a loss here at this hospital, and you guys did such an amazing job helping her years ago, that my sister ended up volunteering for other women who had had similar losses. And so then I thought, well, I want to volunteer too. These people are good people. And so I thought, well, my skill set is interpreting. And, everybody just blew me off on Wednesday nights. I'd show up and I'd go into labor and delivery. And I just remember just that feeling of like, just feeling like a fifth wheel or a third wheel. Which one is it the fifth wheel?
Third,
Or is it a third wheel?
I think it's a
Okay.
third wheel.
Okay. So I
I
felt like
could
a
be
third
wrong.
wheel.
Don't quote me on
I,
that.
I felt like, they were like, okay, whatever. Yeah. Nice to meet you. Cause I'd say, hi, my name is Andrea. I'm an
Yeah.
interpreter in my background. But Atlanta at that point was very, very new to language needs. The
Mhm.
population was very new, especially the Spanish speaking Latino population. And, but they'd say, oh, so-and-so speaks some Spanish. We don't need you, but, thanks. And so I just walk around, and every night I did that for, I don't remember how long, but one night I walked up to someone. Again, it was just one of those moments where things just sort of synchronize. And
Mhm.
I said, listen, I'm an interpreter in my background, but I'm just volunteering. And she said, really? Do you want a job? I was like, oh, like as an interpreter? She said, no, actually, we're trying to start a program. And, we're trying to create a language services program. Would you like to apply? And I said, yeah. Like just the idea that it was not created yet, like they had
Right.
nothing, like the
Right.
potential to help build something sounded very interesting to me. And the timing was just odd. Like I showed up in the evening, but Sandra Savastano Geiger was still there. And she
Mhm.
happened to be where I went to go introduce myself. And they had the job description open for a long time. They just didn't hire because they were waiting to hire her position. And I know a few people in town that are that had known about that position, but then they put it on the back burner for a minute. And long story short, I got the job, and I called Mary Reinerson at Pacific, and I said, and I'm sure I was on a landline. I was like, so like, what should I ask? Like what, I don't have management experience really.
Yeah.
At that point, I had a little at a
Mhm.
photography place that I had been managing one person. Um, and she said, well, don't accept lower than, 30 or something. And I was like, wow, $30,000. Like 1999. I was like,
Yeah.
okay, 'cause you don't want to know what I made in Portland. It was
Yeah.
much
Yeah.
less than that.
Yeah.
And
Mary's a good person to ask, though.
yeah. So
Yeah.
yeah,
Great
she said,
person to
okay.
ask.
So they offered me 13.26 an hour, which I think mathematically, if you multiply that times 2,080 hours a year, was not quite 30, but close enough. And I was just really excited to have insurance,
Sure.
and really excited because Sandra Savastano Geiger, who I still connect with, she's up in Boston now. She just seemed like a wonderful person to be my boss, and I loved that job. I did it for 4 years, and and had a blast because it was all about creating a system and making
Right.
things actually work. And then I went to children's because I kind of hit this plateau. I thought,
Mhm.
okay, at that point everything was running. We had hired a dispatcher, we had some
Mhm.
interpreters. It was a small team, but we were kind of done. And so it was more about day-to-day management stuff. And I had recommended a couple people for Children's Healthcare of Atlanta for their coordinator position. It was a new position, though they already
Mhm.
did have interpreters. Wilma Willer had already started the program. She was the social work manager, and they didn't give the either of those candidates the job. And I thought, well, what are they looking for? And why are they so picky? Like
Yeah.
those are great candidates. So then I was curious, and I'm always curious. And so the curiosity got the best of me, and I called their HR department just to find out more about the job. And I thought, how interesting. Like it seemed like a much bigger job. Children's Healthcare of Atlanta was
Sure.
enormous at the time. They'd combined
Yeah.
Eggleston and Scottish Rite,
Mhm.
and children's care. Like I thought, it sounded like it'd be a very different dynamic, but I really didn't know what the dynamic would be like. Like I just thought, oh, I am really curious because I had only done well baby checks in Portland, Oregon at Kaiser Permanente. And so I just on a whim applied. I was like, well, I'm really curious now. And long story short, I got the job and I did it for 2 years. It was pretty intense. We hired 15 people in 2 years. And I loved it, but I got a little tired.
Sure.
And I think that day-to-day stuff that I knew I didn't really enjoy. I like the creative stuff. I like
Right. Right.
families and interpreting. And I've in both those jobs I interpreted regularly, more at Northside than I did at Children's. But I had these moments where I realized that my satisfaction was weaning
Mm-hmm.
or waning, and my stress was pretty consistently high. And then I had also been diagnosed not too long before that with the same autoimmune disease that my dad had. And and I was like, okay, I'm doing this. I do really enjoy some aspects of it, but a lot of it, I'm not sure I'm enjoying enough to keep
Mm-hmm.
doing this. And I remember just thinking, so how old am I? And when do I get to retire?
Yeah.
Like I was like, I was tired.
Sure.
But I love Children's Healthcare of Atlanta. And I thought, I'd had these moments where people planted seeds or things just hit me. And one of them was Jartu Tolles. That's her name, Jartu, and her last name's Tolles. She was an interpreter we hired at one point during those 2 very busy years. And she looked at me at one point during the interview process and she said, so you used to be an interpreter like daily? I said, yes. And she said, don't you miss it? And I said, I do. And then I just kind of like, it just sort of like settled in me. And I was like,
Yeah.
God, I really do. like I just realized that I was trying to find more joy. And mostly I just realized it was probably going to be just a lot of things that I didn't necessarily feel very good at. And the creation part I really loved, but some of the day-to-day stuff I was not very, I wasn't enjoying as much. And so I had this position that I was trying to hire at Eggleston. No one wanted the job. It was Wednesday, Thursday, Friday, Saturday, Sunday. And they had been hammering me for 2 years. We need a weekend interpreter. We need a weekend interpreter. This is unacceptable. The social worker who speaks Spanish is doing all this interpreting. She's not getting paid extra for this. This is unacceptable. And I couldn't find anyone who wanted the job. And one night, like in addition to a few other things that happened that made me realize, okay, I really like creating things and systems that work, but I'm not sure I'm a manager.
Right.
And I just realized, oh my gosh, I know who I could hire for that job. I could hire me.
Yeah.
And I thought, well, that sounds great. And I had no idea what Eggleston really was about. I would just go
Yeah.
there occasionally because Gabriel was our first interpreter there. At the time, he was the only interpreter. And I would go there occasionally to see him and spend some time with him. But I didn't really know what Eggleston was. And it ended up being like the most amazing choice for me to make. It wasn't easy, though. I mean, like you said, it's
Sure.
unusual for someone to drop down. And so that, like, not continually going, up and advancing and just
Right.
suddenly dropping down, it
Right.
took me some time to incorporate that into,
Yeah.
what I wanted. And I just, because Eggleston is a level 1 trauma center, I was exposed to things I have never been exposed to as an interpreter. There are kiddos and infants and teenagers that have cardiac defects. So it's all about correcting those defects. So it's a lot of open heart surgery, heart transplants, long-term care, multiple surgeries, and you get to watch how your practice affects the family. I had never seen that. Most of my career was one and done. I would see them
Right.
in the emergency department, never see them again for the
Mm.
most part. Labor and delivery, wonderful, but never see them again. So I never
Right.
really knew if what I did or what I said or how I managed the encounter made an impact, good or
Right.
bad. And I love patterns. And I realized, oh my gosh, I'm in a place where I actually get a chance to see what my practice choice did for this family and whether or not it worked or not, based on the words they're using the next time I see them, or over time, the
Right.
words they continually use that are different from the ones I'm using.
Right.
And between that and also we have bone marrow transplant also at Eggleston. So it's, that and ECMO. Though I would say that bone marrow transplant's a lot like that idea of longevity. Those kids are there for a long time and they come back for a long time. So again, you get to see what your decision making does in those encounters based on how the subsequent encounters are with that family and those same physicians. And you learn a tremendous amount about your practice and you make changes. And it's very exciting because then you make a change and then suddenly you realize it made a much better impact. And I love that, but I didn't plan that. It just,
Right.
again, it just sort of like fell into place.
Yeah, you know, serendipity, we were talking about and have talked about before, of just there are powerful things that line up sometimes, and that's an interesting story. And you know, we're glad that you're doing it. There's probably something to be said for just the idea that, you know, you're focused on the craft, you know, very kind of specifically in doing that work, that interpretation work daily, that I'm sure is honing your skills and also probably informing your research quite a bit, I imagine, as well, being sort of on the ground like that.
Yes, absolutely. Yeah, I think that's kind of why when Natalie Kelly sent that email, I just like, I'd already had a couple things happen that I realized, well, that was interesting. That was a very, very long encounter. And I didn't feel particularly fatigued. And then I'd have shorter encounters and where I was like, just somebody give me a cot and let me lay down, you know, after a relatively short one. And I remember thinking how interesting. And I hadn't really put it into words until she sent that email. And I don't think I would have had that experience and had that kind of a thought process if I wasn't doing the work daily at the same place, 5 days a week, you know, 52 weeks a year.
Yeah, that's really an interesting way to look at it. Yeah, thank you for sharing that story. It's all super, super interesting, you know, to me, and I'm sure the community that's engaging, you know, with CCHI. You know, this has been a great conversation, and I want to maybe sort of close with something a little more, you know, off topic, I suppose. You know, is there anything maybe out there that, you know, is interesting about you, or you think you'd like to share with the folks out there who maybe know, you know, I know you as Andrea, highly skilled professional interpreter presenting at conferences, you know, nationwide on interpreter fatigue. Is there something maybe that you'd like to share with us that maybe the world doesn't necessarily know about you, or that you think might be interesting to all of us?
Yes. Well, I'm a blusher, you can tell.
Yeah, well, you know, that's what's great about the internet. Can't really tell that easily.
Well, kind of like I mentioned earlier, just in all of these different phases of my life, I think there's so much serendipity, or I mean, that's one way to look at it. There's that concept of things just synchronizing and coming together. But I love those kinds of stories. And, you know, if you sit down and start asking people, have you ever had anything happen that like you really wanted to happen and then suddenly you realize it's happening and you didn't really plan it? And I just love that. I love connecting with people about that. And I really, as an interpreter, I really love watching. Now, this is not necessarily synchronicity, but I love watching those two sides come together. Like as I'm interpreting and seeing families trust the provider, or seeing nurses very excited to see that family again, and getting to witness that is an amazing thing. But I do love serendipity. And I guess I think the first time I ever realized that it meant something to me, or that just was so unusual, was it was in Portland and Newport. I had been going to Rimsky's Corsa Coffee House in Portland, which is a no sign coffee house, and it's word of mouth. And they had these pictures in the front in the little cafe that had these pictures of a hotel that all the rooms were characterized to authors. And I just remember thinking, and I mean, I was really young. I was like 19, 20, 21. And I think when it would have been right around that time, maybe I was 20, 21. And I just thought, God, I really would love to go there. That sounds so cool. But like, I had no money, you know, like going to a hotel somewhere else was not in Portland. I thought, well, that'll be so cool someday. Cause you know, they had these rooms that were like Mark Twain or Alice Walker, and the room looked like the way you thought they would be as people. just with that kind of decor. And on a whim, I took a Greyhound van from Eugene in my sophomore year. And I was like, I just want to go anywhere. I want to go to the coast. Take me somewhere to the coast. And they're like, oh, we have a van leaving at such and such hour. I was like, okay, great. So I just waited, and I took this van with maybe a couple other people, got off the van and put my Walkman on, because it was like 1990 and 1991, 90. And I was listening to Tracy Chapman, walking around the city on the coast. I didn't know where I was. I had never been there. And I hopped on a like a local bus, and the bus driver seemed kind of like an uncle type, trustworthy. I just waited and waited until people got off the little bus to ask him, do you recommend a place here that I could stay, just a cheap place? And he said, yeah, let me just take you this. It's right on the water. He says, it's really nice view. And they have these dorm rooms, and, a lot of people just pay for a bunk bed type situation, gender, at the time it was like women in one room, men in the other. And, and he said, it's pretty cheap, it's just, you just, pay for the night and you get free breakfast. I said, great. So I walk into this building, and it was in Newport, by the way, on the Oregon coast. And I walk in, there's a lovely lady at the front, and it's just really cute. And I walk up the stairs to look at this room that, they have rooms there, but then they have a cheaper option for people. And it looked pretty nice, clean. And I had gone up several flights and come down several flights. And on my way down, I finally was paying attention, and I saw like a room that said Stella on it. And then I think I saw a Dr. Seuss sign as well. So I'm like, that's weird. And I go down, I'm not thinking anything, and I'm standing there and I'm filling out the card, and it's like name, phone number, I don't know. Author name was one of the lines. And I was like, and I looked up at this lady and I said, is this that hotel? Like, where the rooms are characterized to authors? And she said, yes, welcome to the Sylvia Beach Hotel. And I said,
oh my gosh.
Oh, I've always wanted to come here. I didn't know I was here. And it was the craziest thing. And that was Goody. Goody is a co-owner, I think still. The Sylvia Beach Hotel is still there. And she owns Rimsky's Corsa Coffee House in Portland. And I ended up, and I was very shy then. That's probably another thing I could share. Very, very shy. But she was so personable. She said, you're here alone? I said, yeah. She said, why don't you have dinner with me tonight? So I sat there in the lobby of this cute little building and had dinner with someone I did not know. And that was very unusual for me. And I have gone to that hotel many times ever since. But now I'm a little bit older and I have a little more money. And so I can actually pay for like a room and not a bunk bed. But that was my first experience with serendipity. It was the weirdest thing. And now I think I'm just noticing it. I think most of us probably have these things just sort of happen. And if we notice, we're like, oh, that was total serendipity.
Yeah, that's a really cool story. And, thank you for sharing that with us. And, thanks again, Andrea, for taking the time to talk with me today. And, thank you all out there for watching and listening to us. And I think that's about all we have right now. So have a nice rest of your evening out there on the East Coast. I'm going to finish out my day here in Oregon.
Yes. And, fabulous. Lucky you. Yes.
Thank you, Andrea. Take care.
All right. Yeah. Adios.
Adios.